Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning again and welcome back. Just before introducing Dr. Abdulhameed Alwabari, I would like to all our colleagues here to inform you that at the end of this conference, exactly in Saturday, will be a competition, a scientific competition. So we need all of you to participate in this one because Dr. Khalda promised will be a valuable gift for the first three winners. And this competition, we need to participate with this competition. You need to download this app, Kahoot. It is available in App Store or Google Play Store. So please keep ready to Saturday. Now we'll start with Dr. Abdulhameed Alwabari. Dr. Abdulhameed Alwabari, he is graduated from King Saud. He is graduated from King. He's having a bachelor degree in radiology sciences. He worked in King Saud Hospital in Riyadh in 1996. He have a master degree in MRI from University of Queensland, Australia, 2009. And he worked for the hospital in National Guard in Saudi Arabia for 25 years. He will be our speaker today. He will talk about patient care in medical imaging department. So we know all of us that patient care is very important and it contributes of 90% of the outcome of any procedure in radiology department. It starts with a patient care and it ends with a patient care. So Dr. Abdulhameed Alwabari, he will talk about this and he will give us some tricks in how to perform the best patient care in our departments. Dr. Abdulhameed, you are welcome.
Thank you. Salam alaikum. And I don't like to stand there while I'm speaking. I'd like to go back and forth. أنا كنت أسعى إني أحصل على الكيمارت الأكريديتيشن الكندي، ولما شيكوا السيلبس حقي شافوا ما موجود أي subject عن patient care. So it's weird, really. They told me it's weird that we have all this technologists who will take care of the patient, and he did not study or she did not study the patient care in medical imaging. That's why I have chosen this topic, just to engross your attention to this topic. Actually, it's a book. If you go or Google it in the internet, it's, I think, 8 chapters book. It's big. So I'm gonna just take one part of it, and I hope it will be beneficial. Usually, when we study in the College of Applied Science, we concentrate only on how to perform the exam and produce a high quality image. And really, we did not pay attention to this, which is as important as performing the scan. Don't you agree with me? Okay, so actually, ما في light. Okay, I will talk about this topic today, and I will choose the chapter 1, which is professional practice. How to be professional when you give imaging service to the patient, and it is multiple subtitle, like proper communication, privacy and confidentiality. What's the difference? What's the difference between privacy and confidentiality? نقول وفسر الماء بعد جهد بالماء. Huh? Okay, we'll see it. Yeah. The third topic is consent, how to take consent and type of consent, risk management, and the last one, which is very important these days, legal responsibilities. You know, just to give a brief about the last topic, before, when someone died in the hospital, what the family is going to say? Yoma, it's his day. But now, no. The family are well aware of the patient condition and what should be done for the patient, and if he suddenly died, they will complain to Ministry of Health. At least we have it back in Saudi Arabia. Here I didn't know yet. But this is the topic that we should pay attention to when we give imaging service to the patient. So let us start with communication. Communication first, it's two-way process. You know, I have seen people talking to the patient while he's going this way. He doesn't want to listen to him. He wants him just to listen to an instruction he is talking about, and he wants the patient to follow. Also, as the gentleman here said, the good procedure depends on the cooperation between patient and technology, which is communication, either with the patient himself, with the family, with the sitter, with the coworker, or physician. And we will see what does that mean in the next slide. And there are two types of communication, verbal and non-verbal. So let us see the verbal. You agree that, you know, when you do exam for someone and when you give instruction to, let us say, Egyptian, it is hard to understand our accent. I'm not saying Indian or... we need to make our accent light. Like, you know, if one Egyptian just came to Saudi Arabia and you tell him Riyal, is he going to understand it? We should speak with the patient clear and slow speech to make him really understand, not just to repeat instructions that you keep it in mind. The tone and volume of the patient. Do not talk to him while you seem angry. I know that you are busy, but he doesn't understand this. He thinks that he is a patient and he wants you to just finish his imaging or her imaging. Also, the communication should be face-to-face. You know, as I said, that some techs are just walking away while they are telling the instruction to the patient. And the last one, he doesn't understand MRI, or we will do positioning, or just tell him in Arabic what you need to do for him. In Arabic, if he is Arabic person, or in his language, let us say it this way. The non-verbal is this face, and usually this way also. Talking to the patient this way. That will make the patient anxious. Body language play a role here when you communicate with the patient. Personal space, we don't have it here in our culture. We don't talk to the patient like very close. So, but it's there in the West. Touch. Touch usually when you do imaging for the pediatric. Didn't you touch him? Did you just tap over his head, play with his hair? That will make him relax. Appearance and hygiene. You know, some of the patients really feel comfortable when the tech going to take care of him is well dressed. He knows that he is very professional. And the last one, eye contact. We need eye contact with the patient when we communicate with him. Challenges with communication as hearing and speech impairment. So what's the solution if you got deaf patient? I mean, not deaf. I mean, he cannot hear, like his old age. Can't write. Okay? He can't write. Altered consciousness. And this is usually, we encountered it with severe patients who can communicate with you, but you cannot, you don't feel comfortable to take his word as a true. Is he telling the truth if you are asking him if he has any implant inside him? He's drowsy. He's not fully conscious. So in this situation, my practice, if I'm not sure about it, I'll send him back. I'm not going to take the risk till one of the family member come to take the information from him. Human diversity. If you have patient from Nepal, how you will communicate with him? From India. And he just stepped in Kuwait last week. Housekeeper. Yeah, we used it. The hospital has many nationalities, and we can ask one of the Kabayans, as they said, one of the country mate, to translate to him. Communication with old people, and this happened frequently. We don't call him sir or ma'am, but we call him usually ya am or ya khala, right? Yeah. We should avoid assumption. This is the most important in this slide. Do not say, "Amuruk tayba ya khal." Do not shout at him. You are assuming that he is deaf. Speak with him slowly, and then if he is deaf, or if he has a hearing impairment, you can raise your voice to him, but not from the beginning. Let him feel useful. I encounter number of old people. He want to walk from the wheelchair that they brought from the ward to the scanning table. He doesn't want to go to the other wheelchair and we push him. He wants to be useful. Do not make him feel that, it's just a few days for you. Let him feel that he's useful by simple thing. Let him walk. And if you want to help him, just put your hand beside him. Be the stick for him. And believe me, he will cooperate with you if you just do these things. And with the old people, even if you are busy, just make it slow. Just talk to him gently. Patient, especially the old, has too many things in his mind. So maybe he did not pay attention to you if you talk fast. So you need just to make it slow. It will add few seconds to your time with him. Okay, white came once. Okay. This situation, communication with a patient who experienced a death, like someone was driving and his relative beside him, but the relative died. So how could you communicate with the driver? There is a psychological situation this person goes through. And when you understand it, you will know why he's not responding to you. He might not answer you. He might fight with you. Because when they told him that this person died, denial, he will say no, he did not die. After a while, he will be angry. Whoever come to him to speak with him and he asked him about that person and he said die, angry, and he fight with him. After a while, he will go to bargain. You know, like they will ask him, the nurse might ask him upstairs, we will take you down to MRI. He will say, just tell me that he did not die, and then I'll go with you. That's bargain. He just tried to comfort himself. Okay? And then he will go to a depression, and he will answer no one. And the last one is acceptance. When he accepts, you can't deal with him as any other patient. During these 4 stages, you need to understand his situation. If he shout at you, if he did not pay attention to you or respond to you, yeah, he has a situation. This is not him. This is the situation he is in. Accordingly, give him time. Like if he is not responding, really keep him outside for some time. You can't put another patient. When he is relaxed, if he relaxes, you can't put him. Or you can ask one of the family members to be with him. If you postpone the other day, ask at the time of the appointment one of the family to be with him. But do not, expect that he should follow your instructions. No, it's not necessarily to be the situation. That is communication. Before we go to this one, are we applying what we said about communication? Partially. Partially, I'm sure. But really, this is a skill we need all to develop. Because we are dealing with patients. We are not, I was saying, there is technician and technologist. Technician means the electrician, the plumber, okay? He just do whatever asked and that's it. Technologist, he do patient care beside his job. And that's the difference. Okay, now we go to privacy and confidentiality. Privacy, general personal information, such as professional status, workplace, or marital status. But not everybody needs to know it. If you are in a hospital and you got, let us say, Sheikh, are you going to tell we have Sheikh inside? And that's a status. That's his personal status. Or we have the CEO of Al-Kuwaitiyya. He doesn't, it's really general information, but not necessarily that all the department knows that he is inside. That's privacy. Besides the personal privacy that we take care, like we keep him in isolated changing room, and we talk to him with a low voice. I mean, to not disclose his information. Okay, confidentiality. That's information meant to be secret. Primarily need to be secret. Nobody knows about it. I will tell you an example of this one. You know, if we have like not Kuwaiti person, and you discover he has disease, certain disease, they might end his contract. And this is a problem for him. So this is for him. It's confidential information. Nobody should know about it. If someone has cancer, cancer will spread panic among his family. Do anybody want to have that? That's why this needs to be secret and to be confidential. And medically, they define it as, you can read it. It's to ensure private and confidential information will be withheld from all, except those professionals directly involved in providing the care. يعني ما نسالف فيها في الإليفيتور. This has become old practice. There is no request, isn't it? No paper request anymore. But, you know, it means that you keep the screen blank for the request or the images or the report. And we should only discuss the case with the relevant care provider. نناقش مع الدكتور المسؤول. يعني we found interested cases. يعني I will tell you one that I start to speak about it years after it happened. We get a man غترة ولحية we found he has a uterus. He came for a pelvis, he was infertile, and we found a uterus. It was a case that we involved only the social worker, because they are the one who's going to break the news to him. Okay, and it was dealt as a top secret in the department. Only the radiologist, the manager of the department, and the social worker. And patient file must be kept in your custody. You don't give your access to anyone or leave your access open so anyone can open someone's file, or if it is open, he can't read it. I don't think there is something more to discuss about privacy and confidentiality. Is there anything I did not cover? Okay, the consent. Some procedure, as you know, that need consent. Is consent done before the exam? Yes? Never done after the exam? Yeah, good. And it's informed consent, not come and sign. What consent means? Means you explain to him, we need to give you a contrast, a dye, okay? And this dye, before we give it to you, we have to check renal function, okay? There are things cannot be seen or detected without contrast. So we need to give it to you. You need it. If you did not agree for the contrast, your report will be suboptimal or incomplete. We need to tell him these 4 points before we proceed with the contrast. And if we are talking about CT scan, we should speak about the rare these days, rare consequences of injecting iodinated contrast. And we have to explain the exam fully to the patient.
Dr. Abdulhameed, just remember, 5 minutes remaining.
5 minutes I have. Okay. I'm slow. I used to it. Okay. I'll be quick. Consent without, procedure without consent could be an emergency situation. Like he has injury and I'm not going to wait for consent, I just want to hurry up the exam. Who is eligible to take consent? Is that true? The practice, the tech or the radiologist? Actually, it's part of the radiologist's job to explain to the patient it's medical issue. We have, this is implied. We have two types of consent, implied and expressed. Implied means when he came to the hospital means he needs treatment, he needs medical care. That's implied. Expressed is the written one and the oral one. When we can take the oral. The oral means there is no signature. Maybe the doctor only will sign. When, in an ICU situation, when patient cannot sign for himself and there is no one from his family to sign instead of him. And we need to do urgent procedure for him. So we need to have oral consent. Validity of the consent. When the consent could be valid, when patient more than 18, mental status that he is mentally well. If he is less than 18, it's the mother or father or brother. Okay, you don't take consent from friend. Even if he stays with him in the hospital the whole month. The consent has to be informed, not only signed. For specific, for sure, not for all imaging. And with a specific period. Like it's different from hospital to hospital. If you take a consent for a patient today and you did not do the exam, what's the validity? What's the period of validity for the consent? And where I work, 1 month. I don't know for you here. But it has to have a period. It's not open. Do we have time? 2. Okay.
I would like to give you 1 hour.
Yeah. No worry. Yeah, okay. Yeah, okay. That will be tomorrow. Yeah. Risk management. The 4th topic we will talk about patient care or risk management. Risk management means we need to identify and analyze a risk factor in medical imaging before the patient arrives. And be aware of the recommendation of how to eliminate or mitigate. نلغيها أو نقلل منها هذه الريسك factors. ذلك to ensure safe working environment for patient and technologist. Risk management for both sides. It's mandatory for each technologist to identify a risk situation related to her work area. MRI different from CT, from X-ray. So occupational hazard, that situation we might be in because of our job, is risk of fall. Risk of fall because of the dizziness or because of the slip. back injury. Back injury for who? For the tech who's going to move the patient. Accidental radiation exposure. That one of the risks that we might encounter, because let us assume that the door doesn't close. Someone can just open the door and proceed in. And high voltage cables. We know that all radiology machines operated with high voltage cables. So when we encounter it by way or another inside the room, we should pay attention to it. The second is, one of the risk situation is to be asked to do something you weren't trained on. Like asking X-ray tech to do barium study, or ask MRI tech to do CT, or ask a tech to put a cannula. You know, you might create problem for the patient if you are not trained to do cannula. Extravasation. Okay. The other risk management that we might encounter is to have vague request. Abdominal MRI. So what he need? Liver, MRCP, enterography. So you shouldn't accept this request. This is risk because you might image the wrong anatomy requested. Left knee, the request is left knee and patient is right knee. What you will do? Who you follow? The request or the patient? Yeah. Usually, you know, we take the patient word and we go back to the doctor. But it happened once. Doctor said, no, I want the other. He said, I want to make comparison before the surgery. But yeah, we need to go back to the doctor. Osteomyelitis without contrast. This is, you know, this is because it's more to the specialty. You know, every tech working with a patient should have good range of pathology and what's needed. Osteomyelitis is a question. Is the patient has osteomyelitis? Who will answer it? Radiologist. Without contrast, he can't. So do not say that it's requested. You should know that, you know, osteomyelitis without contrast cannot be answered. It happened once and the radiologist get angry because he said, I can't say that he has collection, he has edema, but I cannot say patient has osteomyelitis. So if you have this information in mind, it will be helpful for the patient.
Dr. Abdulhameed, just we passed the time.
I cannot continue.
Okay, thanks for Dr. Abdulhameed.